Welcome to all the participants here with joining us for this info session. I am Dwight Baker, the mentorship coordinator at Pegasus Institute, and we have with us today the Toronto Metropolitan University. They'll be, of course, providing information about the healthcare integration programs available at the Chang School of Continuing Education. We have Paula Green, Katarina Belazals-Kosko, Tejwada, and Ioana Labib uh, joining us from the TMU. We also have Shabana. Shabana is from Achieve, and of course, as the facilitators from the Chang School discuss the program information and, of course, all of those eligibility criteria and costs associated for those that you, of course, will need to pay for. Then, if you have questions pertaining to access to educational loan or funding for those programs, then Shabana will be able to respond to those questions for you. All right. We have a very short time to go through, and so I'm going to just quickly go through the land acknowledgement. We try to be as inclusive as possible and also be respectful and giving reverence to or respect to those that respect is due to. And so we'll continue with the land acknowledgement. We acknowledge that the land we're meeting on is a traditional territory of many nations, including the Mississauga of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples. It is now home to many diverse First Nations and Inuit and Métis people. As immigrants or newcomers, we're all treaty people, and so we recognize that Toronto is subject of the Dish with One Spoon, Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. We also recognize that Toronto is covered by Treaty 13, signed with the Mississauga of the Credit, and the William Treaties, signed with multiple Mississauga and Chippewa bands. As we gather, we pay respect to their elders, past and present, and acknowledge their enduring presence and resilience on this land. The Pegasus Institute, we try as much as possible to engage in collaborative knowledge exchange or partnerships with industries and organizations within Canada that fosters the integration of IHPs coming into Canada into the practice space. So as much as possible, what we want is a future where as newcomers, trained healthcare professionals, you have experience or training, international experience or training, coming into Canada, you're able to seamlessly integrate into practice here in Canada. We provide pathway guidance, skill development, career connections. And this session today is geared towards one of those career connections. So engaging programs through the Toronto Metropolitan University and leverage those skills that you will gain from those programs to see how best you can launch your career in healthcare here in Canada. At this time, I'd like to, of course, stop sharing and invite the panel that we have from the TMU to introduce themselves and also present the program information to you.
Are you muted?
Paula, okay. Yes, we're hearing you now.
Yes, good morning again, everyone. It's good to see everyone around the table. I think I see some familiar names as well. Thank you so much for joining us today. And thank you so much to Pegasus for inviting us to participate in today's presentation. What we will do is we will each take turns presenting to you about the various programs that are available through the Chang School at Toronto Metropolitan University. And we will leave all the questions to the end, which Dwight has graciously agreed to put us into breakout rooms at the end. So in order to facilitate all the questions that may come. And as participants, you're welcome to join any of the rooms to ask us the individual questions at the end. So that's a little bit about the logistics. And so with that, let me to share my screen. Okay, I'm hoping everybody can see the screen. If you cannot, please send something in the chat or let us know. Okay, perfect. So as I said, what we will do is we will each take turns presenting to you the 6 programs that we presented here are listed. We will name them again when we get to them. And there are 4 of us that are presenting today, and each of my colleagues will introduce themselves as they begin to do their part of the presentation. What we're intending to do is to just briefly talk to you about what bridging programs are, and then get into the specific programs that each of us will then speak about. So a little bit about bridging programs in case you are not familiar. So a bridging program is one that is designed to help internationally educated professionals quickly transition into the labor market when they arrive here in Canada. There are different kinds of bridging programs, and as you will see different elements of the programs that we talk about. Some of them bridge to employment, some bridge to alternative careers, others are about, supporting you pre-arrival before you actually arrive in Canada. Others are about mentoring, and some others about giving you language-specific training in order to help you integrate. And so there are also a range of services that are also typically offered within bridging programs. And as you can see from the screen, I'm not going to name them, but you can see from the screen what those services may entail. So with that said, what we will then do now is introduce you to the different bridging programs that we have for internationally educated professionals within the Chang School. And for the most part, they're sector specific. So we ask again, just hang on to your questions for the breakout room and we will definitely answer them. Okay. So with that said, I am going to transition over to my colleague, Tej, who will introduce herself and the program.
Thank you, Paula. My name is Ithp, and I manage 2 different programs, one for healthcare and one for social work. I'm going to jump right into the content because you already have the context on bridging. You already understand that typically bridging builds on what you already have. So whatever education experience you bring, we're building on that. The healthcare professionals bridging program has 3 different streams. When I say streams, I mean educational opportunities and course series, meaning they are focused on a particular sector. For example, there's one on long-term care and ethics in healthcare. And then there's one on healthcare, health research and data analytics, and yet another one on health administration. While I name them, I want to also position the fact that this is a program that helps healthcare professionals who already have degrees in healthcare and experience take it into alternate professions, alternate healthcare professions, and which is why the 3 streams, long-term care and ethics, and health research and data analytics, and health administration work. Now, they all have commonality. They all have a healthcare systems course, but they also have dissimilarities, obviously, because you're streaming into a specific type of work. And so they would have courses specifically on those streams. So long-term care, for example, would have principles of long-term care, and I'm not going to read the list. And health research would have focused courses on health informatics and analysis. Health administration is looking at business law and health information access and privacy. So this gives you a sense of what are the 3 different streams that you could possibly take through this program and bridge into alternate employment in healthcare sector. These 3 streams can also be bridged a little bit more. You can go on for a placement, which is optional, and you can also take a communication course to make sure that you not only secure placement, but also are successful at it. The length of each of these streams is between Sir, the previous slide. That's okay. The length of each of these programs is actually 8 to 12 months, which is typically what it takes because it's semesterized. I think, Paula, you're not able to move back. Just don't want to miss the information on the previous slide. Sorry, this seems to be a bit of a glitch. I'm going to use my own PowerPoint to be able to speak to it. But you won't be seeing it on your screen, but so listen carefully. The length of each of these streams is 8 to 12 months, and the courses are 6 to 7, depending on which stream you take. The format is online. So we have a learning platform called Desire to Learn, D2L, and we also use Zoom to ensure that you get a good learning experience there. This is asynchronous learning, and you can also have lab hours built in. The cost of each of these streams is anywhere from $3,000 to $4,200, and the intakes happen in January, May, and September. In terms of how do you fund yourself for this, there is a Watson bursary that the Chang School students can have access to. There's also there's opportunities in more than one semester to apply for this bursary. So you can apply multiple times because it's a 3-semester. It will take you 3 semesters. It's not eligible for OSAP, and the outcome is a professional development award that you get, plus placement and employment. So this is an example of a bridging program that was geared towards employment with an optional placement. Not sure if you're aware, Paula, there are some pictures on the screen. I'm not sure. Okay. Katrina, may I ask you to pull up our presentation?
Yes, I can share it.
Thank you so much. I'm going to just move along to my next slide because I can see it on my end. Who can take this program? So the people who can take this program have to be residing in Ontario as Canadian citizens, permanent residents, refugee claimants, or convention refugees. Like I said, bridging typically builds on what you already have. So you're expected to have a bachelor's degree in healthcare or a master's degree in healthcare and at least 1 year of experience. You might also have it, and the other possibility educationally is that you might have a diploma in healthcare, but then we expect you to have 2 years of experience in healthcare from your country where you last practiced. The proficiency in English is a must. And that's a must across all bridging programs because we are an English-speaking province. So usually you're looking at an IELTS, which is a language assessment of 6.5 or Canadian language benchmarks of 7 and 8. And some of you, if you're overseas, might wonder what this is all about. And I think most people do know IELTS. The Canadian language benchmarks are very similar. Usually people who go into university education have these levels. It's not unusual to see that. Thank you, Katerina. Can we move along? This was the first program that I wanted to talk about, bridging to healthcare and alternate employment. And now I'm talking about the Internationally Educated Social Work Professionals Bridging Program. This program is funded by the Government of Ontario to support social workers who are coming into Ontario as immigrants. Moving along. The program offers 2 different things. It offers a certificate in Canadian social work practice, which is a 13-month-long certificate, which is over 4 semesters. The courses that are there in this particular certificate are credit courses, degree credit courses, and same is the case with healthcare. So some of you might, I'm not sure about the audience, do they all have understanding of degree credit versus non-degree credit? But just so that I clarify at this point for everybody's sake, degree credit courses can be used to ladder into further education. So in this case, there are 6 degree credit courses, and that includes a placement as well. The format is online. The courses are online using, again, our learning platform D2L and Zoom, but the placement is in person. The intake is in June. We start in June. And in terms of bursaries, Award Spring is a bursary that is available to our Chang School students. Students can apply it multiple times over each semester. And this program is also eligible for OSAP. In case someone is wondering what is OSAP, OSAP is a loan program for residents of Ontario to come and take further education. Sorry, can you go back?
Oh, sorry.
That's okay. The outcome. So what do you get when you do this? After 13 months of education, through coursework and placement, you earn a certificate in Canadian social work practice. 89% of graduates of the certificate program, year after year, have secured commensurate employment in the social services sector. This program has been running since 2005. And some exemptions to this program are that underemployed internationally educated social workers who are residing in Ontario, they may receive an exemption from 1 semester worth of studies, and it's a prerequisite course. Could we move on, please? On your screen now, you're seeing the structure of the program. The program starts with the prerequisite course, Academic English Skills for ISWs. I just mentioned that some people underemployed ISWs can be exempt from 1 semester. This is the semester they get exemption from. But everybody else is required to take 5 different courses. Again, I'm not going to name the courses. The way I would explain the program is, these are the courses you really need to take, and this is the information that you really need to have to be able to work in Canadian social work. If you're thinking of social work as a profession, it's very context sensitive depending on where you are. Coming from which country, your practice could look different. So the law in this country is different, the social policy is different. What social workers do is slightly different than some other parts of the world. So this is what you learn through the entire program. And then placement is an opportunity for you to really express that and apply your knowledge and then be supported for employment. Next slide, please. The other intervention of this program is the Introduction to Social Services in Ontario course. This is a short introductory course for people who are trying to figure out what sector to target, what kind of employment would make sense to them given what they've done. Because it doesn't, just because you worked in a certain sector in another part of the world, it may not be easily transferable into Canadian social work. And this course helps you think through that. So people sometimes take both the certificate program and the introductory course, and sometimes they do just one or the other. Again, this is an outcome-based program, which you get a recognition of completion and you're supported towards your job search. It's an online course and it costs you $505. I believe I missed saying that the certificate costs you $6,500. In this particular short course, you start in October. There are no bursaries available for this course and no OSAP, so which means you have to self-fund yourself to take this course. If somebody is a refugee claimant, they can get assistance from their caseworker to be able to take this particular course. But other than that, everybody has to self-fund. Next slide, please. Who can take this program? So you have to be residing in Ontario, and you have to be a Canadian citizen, permanent resident, refugee claimant, or a convention refugee. And you must have a degree at the undergraduate, meaning bachelor's or master's level in social work, or in a related field. The example of related field would be psychology, gender studies, human rights. Those are primarily the kind of related fields we talk about when you talk about social work. Because it's a regulated profession, it's really important to meet this criteria. We also look for 1 or 2 years of paid accumulated employment, 1 year for those with degree in social work, and those that don't have a degree in social work are required with 2 years of experience. The Canadian language benchmarks are 7 and 8, and the IELTS equivalent would be 6.5. I'm seeing a lot of questions coming in the chat, but as Paula previously mentioned, we're going to take the questions later on.
Yeah.
Are you okay, card?
Yeah, I have a gift card.
I'm
How
sorry,
much is it altogether?
26.24.
So I guess
there's a lot
$20.
of disturbance. May I request everybody else to be mute? Thank you. Moving along. I'm going to now ask my colleague, Katerina, to really take over explain the next program, Mid-Level Managers with Technical Background Bridging Program. Thank you, Katerina.
Thank you, Tej. And thank you, Paula. So hello, my name is Katerina Belazelkoska, and like Tej, I am managing 2 programs at the Chang School, 2 grandfather bridge training programs. What that means is that these programs were initially funded in the development stage and the first round of running the programs, but they have been successful. So the government continues, the Ontario government continues to support these programs through bursaries, the Ontario Bridging Participant Assistance Program. So let me quickly go through the mid-level managers with technical background bridging program, the MLM program as we call it, because it's a mouthful. So it is a program that is, as the title says, people with technical background. And the length is 2 semesters, 8 months. 4 courses, 2 required, and 2 groups of electives. So 2 electives. So 4 courses is what is required to pass. And the graduates are getting a certificate in project management for technical professionals. We do not meet on campus, so the instruction is through Zoom and our learning management platform, Desire to Learn, D2L. The cost of the program, including tuition and textbooks, is around $4,500. It is fully covered for eligible participants in the MLM program who express financial need. The intakes are in January and in September. So our second cohort for this academic year, the January one, is already in session, and we have 25 who started in September. As mentioned, the bursary is really great support. So 50 MLM students are fully sponsored to take the course by the bursary that is, as mentioned, generously offered by the Ontario government. The required courses are fundamentals of project management and agile project management. One of them is enough to qualify to take the exam with the PMI Institute, Project Management Institute. So in the electives group, students can choose between 2 courses that are, again, project management focused, and 2 courses that are focused on the communication skills of project managers. The requirements to be eligible for the program, but it's specifically for the bursary, is to be a Canadian citizen, permanent resident, or protected person who resides in Ontario. I know that some of you are not residing in Ontario. That is why I'm kind of putting an emphasis on that eligibility criteria. They have to have an international education, post-secondary or higher degree from another country, not Canada, in a technical field, IT engineering, architecture, and similar. Minimum 2 years of working experience in project management and an English language proficiency of level 7. So that's in a nutshell. Of course, if you have more questions about the MLM program, we can discuss that in our special room. The last program of the 4 that we mentioned that are supported, that are classified as bridge training programs, is the Workplace Communication in Canada program. And it is a pan-professional program, meaning that we have doctors and engineers and teachers, name it. It applies to anybody who is new to Canada and really wants to understand the do's and the don'ts, as we usually say, the norms, the values, and what works best in a Canadian working culture. So it is 4 months, 4 courses, and again, we use Zoom, and there's content available on D2L as a part of each of the courses. It's pretty intense. We teach on Saturdays, and it is really in-person sessions, but also a lot is going on between those in-person sessions on Saturdays. We chose Saturday because most of our students are either looking for a job or having a part-time survival job. So that has proven to be a very convenient timing to take the workplace communication courses. We have 3 groups in September, in January, in March. So students can choose between these possible starts for the program. It is fully covered. The cost of $3,350 is fully covered by OBAP. Again, the bridging bursary. And we have been lucky to get 100 spots covered per academic year. So 100 students can take the workplace communication in Canada. And at the end of the program, if everybody passes their 4 courses, they're getting Professional Development Award from the Chang School of Continuing Education, Toronto Metropolitan. The courses, just, I will read them because it's not too many. So we start with effective speaking and listening skills. Then we move to client-centered communication. It can be a patient, it can be a student, it can be any kind of customer, depending on, but it's really generic in that sense. Then we move to presenting with impact and complete the program with teamwork communication. As we know, we are in a very diverse country. Teams are very diverse. So this is an amazing program, subject matter experts, practitioners, they're totally amazing. Now, the eligibility criteria are almost the same with the MLM program and any other program that depends on the bursary, because the cost, as we know, is pretty high, although we do have students who decide to self-finance their studies, or there are employers that contact us and are willing to support, to sponsor an employee that they are planning to promote most of the time. That's the main motive for them to sponsor somebody. The English language proficiency is at level 6, the lowest of all bridging programs at this moment, because we're still working on communication and all the other skills, all 4 skills. And of course, as for any other bridge training program, international post-secondary education degree is required. Thank you.
So Joanna, over to you.
Hi, everyone. Thank you for joining us today. My name is Joanna Levy, and I'm the Student Affairs Program Advisor for the nursing program over at the Chang School. I'm just going to touch base on the transition to nursing practices in Ontario. It's the new TTP program that was just launched by the CNO. And the Chang School was selected to become one of the partners who will deliver the TTP program course. So I'll just kind of walk you through it. And then again, we will be available in the breakout sessions to answer any questions that you have. Sorry, Paula, if you just want to go to the next slide,
please.
Thank you. So again, this is a newly launched course that we've just developed. It's hot off the press. It is it's a total of 10 weeks to basically get this component. It's one class. We will be running the sessions weekly through synchronous delivery. So you can expect to be online in class, usually one evening per week, and then you have some content that you have to complete online as well. And then we do have a few different formats, days of the week that we will be offering it, just to kind of open it up to your schedule and see what works best. The cost of the course is $731, and we have 3 intakes, which basically start in January and then again in May and September. So right now we'll be launching our spring-summer session, which begins in May. We will be starting that course on the week of May 4th. And basically the outcome of taking this course is to meet the CNO's 9th requirement to support your application for registration to basically become a nurse in Ontario. It is, again, like I mentioned, just one required course. It's called CVNU 200, and it's titled Transition to Practice. So in order to qualify or to gain the most out of this course, this is really targeted towards internationally educated nurses who want to become nurses in Ontario. They've put in their application and they're missing their 9th requirement. So taking this course would meet the registration requirement set out by the CNO. Again, this came into effect on April 1st, 2025, and it's basically just designed to make sure that nurses are successfully integrated into the Ontario healthcare system, which is kind of where they've identified that there are some gaps. So they've introduced this course to hopefully tie that all in. Thank you.
Thanks, Joanna. So we come to the final program that the Chang School will present on before we turn it over to Achev. And that program is called the International Midwifery Pre-Registration Bridging Program. And that program is for internationally educated midwives. So what you're seeing on screen is the page, the website page that you will see when you go to the Toronto Metropolitan University website to look up the program, to find the program information. This is the screen you should come to get information about the program. Next slide, please. Okay, so we have two options for this particular program. One is 6 months and the other is 9 months. The 6-month program will typically start in the fall. So September of 2025 is the first cohort of students that we would run through. And then spring of 2026 is potentially when we will run the 9-month program. There are 7 courses in all. I will show those to you in a few minutes. And the format, similar to our other programs, is that it is primarily virtual, but there are some in-person components to this particular program. So the placement and so on, and I'll share that with you in a little bit later, is in person. The full cost of the program is $12,000, so it's $11,999, or just $12,000. The intake is ongoing. But we have specific start times. As I said, the first cohort of students will start in fall 2025. And just a brief, quick history, we did offer a similar pre-registration program for a little over 20 years, and that was from 2003 to fall of 2021. So what we've done is done some research, and now we are relaunching a new edition of this particular program. The program is not funded like some of the other programs that you heard about. So you will need to rely on either your personal financing or organizations such as Achev to help you self-finance if you are interested in taking this program. And the outcome is that we will prepare you to write the Canadian Midwifery Registration Exam, which takes place in May and October of every year. Next slide, please. So there are a total of 7 courses, and they are listed here. The first course is the Midwifery Skills Assessment, which is a pre-assessment course. It is 1 week long, and the cost for that course is $740.80. So a little over $700 is what you'll pay for the course. You have to pass that course to be made eligible to continue on taking the remainder of the 7 courses, which are listed here. If for any reason in your 7th course, which is your in-person placement course, you still need a little time to get better oriented, acquainted to how midwifery functions here in Canada, you will have an option of paying for an additional 4 weeks of time to successfully complete your placement. So that's basically the arrangement of the program in terms of courses. Typically, the courses are about 5 weeks long. For most of them, we have one of them, I believe it's CVIM 310, that is about 4 weeks long. With the midwifery skills assessment, we will require you to do some in-person pieces, but the remainder of it would be virtual. And then the placement, as I said, they are in person. And then 310, we also, for you to do things like emergency skills and first aid, emergency first aid for infants and so on. Those small courses will be like half days, etc., will be in person, but everything else for the most part is going to be virtually or basically online. Next slide, please. Who is eligible for this program? You can be a Canadian citizen, a permanent resident, a convention refugee, an international student, a study or work permit holder. Now, there's a caveat for study or work permit holders. The folks that have a work permit, the 6-month option is the only option available to you. because anything longer than 6 months in terms of study, you will require a study permit. So the 6-month option is the one that you're limited to if you are a study permit holder. You need to provide assessment from an acceptable Canadian Credential Assessment Service. One example of that is World Education Services. So your degrees and transcripts, etc., must be evaluated by them, and we must have some information about the studies that you've done and its equivalent to the Canadian credential as part of our assessment. You must have also practiced midwifery within the last 10 years, and you must have delivered at minimum 100 births. Those births could be divided into during your education, learning to become a midwife, you did about 60. And then after you started to work as a midwife, you did a minimum of 40. So that could be one of the ways in which the 100 births are distributed. Or if you've been working as a midwife for a very long time, that's okay too. You might have been doing 50 to 100 births a year. So you need to just provide us with evidence. And that typically comes in the form of a reference letter indicating number of births, as well as a resume indicating where you work, etc., as well as contact information for us to follow up if we have any queries. You should be also an undergraduate degree holder or some kind of formal education in midwifery that is recognized in Ontario. Or from a recognized post-secondary institution. And this is where the Credential Evaluation Services will tell us that. You must also meet some of the minimum English level requirements and some of the English level proficiency tests we accept. Next slide, please. I'll just quickly show you what those are. I'm not going to name them, but all of this information can also be found on the website, but you can see the range of scores that we typically accept in terms of the English language scores. And so that too must be a part of your application process when you submit the application to us. Next slide, please. Right, so this is where I think we probably may want to turn it over to Achev. Shabnam, I don't know if you want to do something very briefly, and we will stop sharing our screen before we go into the breakout rooms.
Sure. Yeah, I'll just do a short presentation about financial assistance to help you pay for your training. I'm going to go through the slides quite quickly. I'm just going to focus on the main slides because I know due to time restraints. So my program is called the Accelerating Career Advancement Program. My organization is Achieve. We're a nonprofit organization. We are funded federally to the Government of Canada's Foreign Credential Recognition Loans Program, and we are in partnership with Meridian Credit Union. So I'm just going to skip over the slide. Now I'll talk about the eligibility criteria. So the individuals who are eligible for our program to get an educational loan to pay for the bridging program or the licensing process in Canada, you must have education outside of Canada, which all of you have, and you must be a resident of Canada, meaning you have to hold either a PR status, Canadian citizen, or conventional refugee status. Unfortunately, we cannot assist individuals who are refugee claimants, international students, or individuals here on a work permit. You must have status in Canada, and you must reside within Ontario. And you're an internationally trained individual seeking to having your credentials recognized in Canada. So maybe going through the licensing process to become a licensed nurse or midwife, or you're pursuing an alternative career or both. So now I'll talk about our educational loan. As I mentioned, we're partnered with Meridian Credit Union. That is the financial institution that we use to help you get the funds to pay for your training. And you can receive a loan to a maximum of $30,000. And this could include tuition, books, transportation, living allowance, even childcare. The interest rate is very competitive at this time, and it's a fixed interest rate of 4.75%. So if you don't qualify for OSAP or the OBAB program, this would be the next best option. So if the program does qualify for OSAP, that is your best option because you don't have to pay it off right away. You take your training, there's a grace period, and then you start paying it back. But with our educational loan, the repayment does start after 30 days. So there has to be some form of income to show that you can do the monthly payments. So you're either employed, part-time or full-time, self-employed, for example, Uber, or you would have to have a co-signer in your application who is employed and has good credit, who's willing to co-sign on your behalf. And the repayment terms vary from 1 year to a maximum of 5 years, depending on how much you borrow. And I'll just show you some examples in the next slide of how the repayment will work. And you'll get continued support from myself. So I'm here to assist you in helping you find a job once you're done this bridging program. So these are the eligible expenses: qualification assessment fees, association and examination fees, tuition, books and material, short-term bridging program, travel expenses, living expenses, and new career path in an alternative career. All of this can be covered to a maximum of $30,000. So if you do take OSAP or you've qualified for the OBAB bursary and you just need extra funds, you can still come to us and we can still assist you with some extra funds if you just need a living allowance or something like that while you're taking the program. And these are the two documents that are required for Meridian Credit Union. One is a learning plan that breaks down the fees for tuition, books, transportation, examination fees, etc. And the other one is a loan assessment. This has to do with your income, your household income, and any other expenses that you might have. Visa card, MasterCard, line of credit, all of that is put into the loan application. And we submit it to Meridian Credit Union that is closest to your home. So the bank, which is Meridian Credit Union, will assess and decide whether or not you're approved for the loan. And these are the documents that are required for the bank: your SIN number, valid ID, $1 to open up a bank account. Because if you do get approved for the loan, now the money is deposited into this new bank account. You're going to use it to pay for your fees. And then on a monthly basis, you're going to be paying it back. Address verification, notice of assessment. If you've lived in Canada less than a year, you won't have this document, and that's okay. But if you've lived in Canada more than a year, you're supposed to be doing your taxes, so you must provide your notice of assessment. Bank statements, at least 3 months of bank statements, and then your most recent Visa card, MasterCard, line of credit, etc. And if you are employed, a letter of employment plus 2 recent pay stubs. If you're not employed and you're using a cosigner, that individual would have to provide a letter of employment plus 2 recent pay stubs, plus all of the above documents here. I also wanted to mention that if you're on Ontario Works or ODSP, you could possibly be approved for the loan. So they take household income into consideration. So if you have children and you receive child tax benefits, you could be approved for the loan based on your Ontario Works plus your child tax benefits. So now I'll just go to their website just to show you how the repayment will work so you can visually see the repayment. And I'll just use a few examples from the bridging program. So I'll start with the lowest amount, which was I'll just round it out to $732, and that's for the internationally trained nurses. So with this program, the interest rate is still fixed at 4.75%, and you would have 12 months to pay this off. So your monthly payments would be $62.58 every month for 1 year, and your total interest is only $19. So all that you're doing or paying extra out of your pocket, it's just $19 over a 12-month period. So instead of putting this on your credit card, which might be 20% interest rate, this will be the best option for you. Next, I'll go to the other example. I think it was $3,000. So with $3,000, you still have 1 year to pay it off. The monthly payments would be $256.48 every month for 1 year. And the total interest on $3,000 is just $78. That $78 is split up over 12 months. Again, instead of putting it on your credit card, which is a high interest rate, this is the best option for you. And next, I think it was $12,000. So with $12,000, you would have 3 years to pay this off. Monthly payments for $12,000 would be $358.31 every month for 3 years, and the total interest on $12,000 is less than $1,000. It's only $899, and that $899 is split up over 3 years. It is an open loan. You could pay it off at any time. There's no penalty, and you will save on the interest. So those are just some examples of how the loan repayment will work. And I'm just going to stop sharing and go back to my presentation. Sorry. So if you are interested in starting the process or connecting with me, there is a QR code on the screen. You can just scan the QR code. It'll take you to an MS Forms page. Fill it out as much as you can. I'll receive it and I'll connect with you before the end of the day today. If you're not ready yet and you're thinking about it, no problem. Just take a picture of this and connect with me whenever you're ready. So we're here to provide an educational loan, either for the licensing process, for the bridging programs, or just even a living allowance while you're taking the bridging program. So we're funded through the Government of Canada for internationally trained individuals like yourself to help support you so you don't have to put it on your high interest credit card. But that's it for my presentation.
Dwight, do you want to put us into breakout rooms so we can?
Okay.
Thank you.
Thank you so much, Shabana, and the facilitators from TMU for providing the information about the various programs. The breakout rooms are now open, so they're labeled accordingly. You can all join the room and feel free to ask the questions. I see a lot of questions are going up in the chat. Some of them I saw Tej responding to, some of them I was also responding to some of them, but feel free, go to the breakout rooms now and ask the facilitators about this specific program that you are interested in. So you can look at the bottom of your screen, you should see the breakout rooms there, or if not, you should see three dots that says more. You can click on it and then select the breakout room option, and you will see the option for the breakout rooms. Katarina? Okay. Okay, so for the persons that are remaining in the main room, if you have questions that you would like to pose to the facilitators, whether they're financial questions or questions pertaining to the program itself, I'm going to ask you, please select from the list of breakout rooms, join one of those breakout rooms, and ask the facilitators your questions. So this is your perfect opportunity for you to have your questions answered. Again, please join the breakout room to speak with the facilitators if it is that you have questions that were not responded to in the presentations. If you need guidance with joining a breakout room, feel free to let me know and I'll provide you with some directions in terms of how to go about doing that. The purpose of this session is for you to interact with the program facilitators and find out as much about the program as possible to see how best you can, of course, launch forward or get integrated into the Canadian healthcare system. So we have breakout rooms for healthcare and social work. So all of those healthcare bridging programs and social work, you have a room for that. There is project management and workplace communication. There's midwifery bridging. There is nursing, and then there is educational loan or financial support. Feel free to join the room that speaks to whatever your need is. Again, just pointing out that there are breakout rooms open for persons who are still in the main room. Feel free to join the breakout room that is of interest to you to have conversation with the facilitators about their specific program. We have Achieve with educational loan and financial support. There is nursing from TMU, midwifery bridging from TMU, project management and workplace communication from TMU. And then there's also healthcare integration programs and social work from TMU.
I guess Dwight brought us back to the room in case there are other people who still have questions. I would
Yeah.
like it for us to wrap up.
Yeah, and Paula and Dwight, I did answer most of the questions in the chat. There were a couple on the MLM program that didn't get answered, but I'm hoping that those got taken up in Katrina's room. And Paula, there was one for you, and I'm sure somebody probably checked in with you on midwifery. But other than that, I also plunked in our emails along with the program, not the program name, but at least the sector, so that people can easily access that information.
Yeah, thank you so much, Tej. Appreciate it. And Shabana, nice to meet you.
Thank you.
As well, I'm sure we'll be in touch.
For sure.
Dwight, are you still here? Or
I don't see it.
I don't see him either. Okay. Are there any questions from anybody else that's still hanging around that have a question for any one of us in the room here? If not, we will wrap it up and say have a good day. So we'll give you 30 seconds to raise your hand if you have a question. No, and as Tess said, we did put the information in the chat.
Hi.
Hi.
Uh, Yeah, can you please share the recorded presentation with us? I somehow had some problem with the net and I missed a major chunk of the lecture.
Okay, so then we'll have to ask Dwight. I'm sure he'll probably send it around. So Dwight and from Pegasus should be the one that should be able to send that around.
Thank you so much. Thank you.
Okay.
Okay.
Any other question from anybody before we leave?
Dwight's back.
No, Dwight.
Sorry about that disconnection. Thank you so much,
No
Paula, for
problem.
taking charge here.
No
All right,
problem.
so thank you to all the facilitators, of course, from TMU and from Achieve here with Shabana for presenting the program information and interacting with our participants. And for the information, of course, pertaining to the respective programs, I'll be happy to share that with our group. And whatever referral, of course, coming in from these conversations, then you can look out for those in your respective emails. All right. Thank you again for listening to and having those dialogue. And we'll look forward to, of course, continuing those conversations
Absolutely.
some
Yeah.
other times, of course, with other IHPs as they seek to enter the Canadian healthcare workforce.
Thank you so much, Dwight. We really appreciate it. And thanks for the opportunity. And I did have one of the participants ask if the recording will be shared with them.
Yes.
Okay, right. So that's perfect. And we're happy to, and we'll be in touch so that we can, share information on sort of the follow-ups that came through and so on. And we hope that this is one of many longer term opportunities that we will have together. To talk about opportunities for IHPs. So again,
Sure.
thank you so much for the opportunity.
Definitely looking forward to some of those expanding of these groundwork. All right.
Okay. Awesome.
Enjoy
right.
the rest of your day, everyone. And
Thank you.
Thank you.
All right.
Thanks.
Take care. Goodbye.
Bye.